A beautiful and healthy smile. It's your personal calling card, a key to your personal appearance, and a key to your overall health. Welcome to Kansas Perio and Dental Implants, a leader in helping you maintain the benefits of great oral health. Hello everyone, I'm Barbara Baum and I'm happy to introduce you to the professionals here at Kansas Perio and Dental Implants. The team is led by 3 periodontists, Dr. Jason Wagle, Dr. Tanner Brock, and Dr. Mark Hagan. What patients notice first is the welcoming, spacious lobby. For the team at Kansas Perio and Dental Implants, the #1 priority is patient outcomes. Those outcomes are built on 3 guiding principles: a strong relationship with your dentist, a commitment to the latest technology, and a desire to improve services through continuing education. But just what is periodontics and why is it important to your overall health?
Periodontics is a specialty of the bone, the gums, and the roots of teeth, essentially. The parts of the mouth that hold the teeth in place. It was established by the American Dental Association in 1947. It was recognized as that specialty, and at that time it was primarily focused on deep cleaning and periodontal surgical procedures to try to save the teeth and treat gum disease or gum infections. Since then, it's evolved a lot into perioplastic procedures, regenerative procedures, growing bone and gums, repairing the damage of periodontal attachment loss. In the early 60s, 1963, 1964, P.I. Brandemart discovered something called osseointegration. Just kind of happened across it through some of the research he was doing in Europe. Well, what that evolved into was basically a root replacement system. So osseointegration is the process of having the metal integrate into the body, the titanium metal integrate into the body, making it more solid and replacing the roots. The implant is the root, the new healthy root that the tooth can be attached to or the bridge can be attached to. We work very well with the other dental professionals, orthodontists, endodontists, and general dentists as well, and prosthodontists, all trying to make sure that we get the implant in the right spot and get the best outcome for the patient. A good candidate for a dental implant is a patient that's missing a tooth or teeth. Not only is there a fact that periodontal disease has been associated with an increase in inflammation and other diseases such as cardiovascular disease, diabetes, low birth weight babies, and things like that. Ultimately, we like to try to keep patients' teeth for a lifetime. That allows them to have proper function and a good quality of life. Periodontal disease is not, you're not doomed to necessarily get periodontal disease. Not everybody gets it. 75% of the patients over 65 might have it, but just because you might get it also doesn't mean that you're going to lose your teeth. Oftentimes with treatments, we can preserve the bone and the gums and help stabilize the infection. Patients can sometimes determine whether or not they have gum disease if they're noticing their teeth are shifting or are loose, or if they're seeing spaces between their teeth or root exposure. Those are things that a patient might notice that they have periodontal disease.
My name is Chelsea Schaefer, and I was brought to Kansas Perio and Dental Implants due to having periodontal disease. My experience was kind of embarrassing. Once I noticed my mouth was always dry, I did notice that there was always kind of a smell, honestly. Once I was able to come here, they educated me a lot on what I needed to do, how to prevent it, and set me up with a treatment plan. And they gave me hope that it wasn't a permanent issue. I had to have a few deep cleanings at first. I had very high dental anxiety, so that was kind of how I ended up here in the first place. I didn't like going to the dentist a lot, and they basically brought me in a few times to do the deep cleanings, and then they would educate me and show me how to make sure I could maintain it. They let me know that I would be taken care of. The staff they are so much fun. So when you're in a situation where you feel uncomfortable because you have things going on, because you don't get to a specialist until you're at a bad spot, they would make you laugh, they would make you comfortable, answer any questions that you had, and then they really did just make you feel like the end result was going to be a positive experience.
If you experience loose teeth or are missing teeth, ask your dentist about Kansas Perio and Dental Implants here in Wichita, or call right now. Call 316-927-5500. For a complete list of services, visit us on the web at kansasperio.com. To ensure the best outcome for you, the team at Kansas Perio builds a strong relationship with your dentist.
Hey Kamika, this is Bailey over at Kansas Perio. I am just calling to confirm your appointment. We've got you down.
All dentists are pretty well-rounded experts in treating the teeth, but again, there are so many aspects of our mouths that can be more complicated, and so different specialists will have different degrees of training and experience in treating certain areas. It would be comparable to if you see your family physician and they refer you to a specialist for your heart or your lungs or diabetes or something like that. Your physician is still going to be your primary caregiver, but by referring you to a specialist, you're getting the more specialized care while still seeing your primary physician for overall healthcare needs. So as a periodontist, our goal is to help people keep their natural teeth for as long as possible by treating the structures that support the teeth, so the gum and the jawbone. But in circumstances where a patient may have lost too much of that support, or the tooth may be too badly broken for the dentist to restore, we may speak to the dentist about removing teeth and replacing them. And so one way to do that would be with dental implant. That's one of the most successful ways that we replace teeth. But that treatment is a partnership between us and the dentist.
An implant is an individualized restoration. It doesn't require restorative care on the adjacent teeth. It doesn't damage the adjacent teeth. And it also improves overall function and security. So a removable partial denture or even a denture may move side to side, while an implant will help keep it into place more comfortably.
As a patient at Kansas Perio and Dental Implants, the success of your treatment is also enhanced by the state-of-the-art technology available to you. Dr. Hagen, tell us about this technology. What are we looking at?
Yeah, so we're looking at a cone beam CT. In order to really have a successful patient experience, what we want to do is gather as much information as we can, which always starts with a personal conversation with the patient, finding out their goals and wishes, and making sure they don't have any concerns or anything. And then we do a thorough clinical exam, correlate that with the traditional two-dimensional x-rays that we use. Those are very good at measuring bone levels, looking at cavities. But then we're able to use the cone beam to provide us with a three-dimensional image of the facial structures. The 3D allows us to localize and visualize infection in the mouth, map out any anatomical structures like arteries, nerves, the location of the sinus, and then any measurements of bone height, width, if we're looking at placing a dental implant. Because of what it provides us with, it's really become the standard of care when doing implant dentistry. The clinician needs to know how much space they have before getting into a nerve space, before entering into the sinus, and also to plan for if you need a bone graft when you're looking to place an implant.
How does that make your patient feel more comfortable?
Because we know where everything is, and we're able to really ideally plan it digitally, and the patient's able to see that, and we go through that together. And so if we plan it into an ideal location, which we're able to do with this software, then we're able to take out a lot of the potential complications that can occur. And that's one thing that with this we're able to put the implant into an ideal position digitally, and then we have another piece of technology that we'll talk about that allows us to transfer that planning directly to the patient.
Just as the cone beam CT helps to deliver a comprehensive look at the mouth, every patient at Kansas Perio and Dental Implants benefits from other state-of-the-art technology. And doctor, what are we looking at here?
This is a X-Guide navigation system. So on the day of the procedure, we're able to take that cone beam scan that we took and integrate it with this X-Guide software. It provides real-time movements of our instruments during the surgery, ensuring that the implant is placed at the proper position, angle, and depth.
What are the benefits of this piece of technology?
It provides turn-by-turn guidance, similar to a GPS, but in the mouth. And that allows us the confidence that we place the implant in the correct position, and it should give the patient a lot more confidence knowing that the planning that we made with the cone beam is directly transferred to their care.
And this is different than other technology.
It's different than prior to the technology. You would do it what we called freehand, and where in that scenario you place the implant just based on what you see through the mouth. But with this software, we're able to actually see where our instruments are in the patient's mandible or maxilla.
Another great piece of technology that we have here at Kansas Perio is the Perioscope, which is a dental endoscope. This is an ultra-small camera that's gently placed below the gum line, allowing us to see the root surface up to 48 times in magnification. The Perioscope is a non-surgical procedure, allowing us to gently clean and thoroughly clean the root surface, improving the gingival and bone health, oftentimes preventing tooth loss and surgical procedures.
When I realized that I had the periodontal disease, it was embarrassing. I would always keep my mouth closed. If I was next to another person, I would turn my face away from them, or I would cover my mouth. Now, I don't have any of those issues. I know that I can stand next to somebody and have a conversation, and I have all the tools that I need. So if I do get a dry mouth, I do understand that I know what to look for now. So if I have any complications or my mouth starts to get extra dry, I know the things that I need to do to prevent future issues and for it to start flaring up. It has been very life-changing, honestly. When you have dental issues, you lose your smile. It does affect your self-esteem, sometimes even your self-worth. You don't want to present yourself out there. But when you have people like Kansas Perio who take the time to give you that back, it gives you your life back, honestly.
If you're experiencing loose teeth or are missing teeth, ask your dentist about Kansas Perio and Dental Implants here in Wichita, or call right now. Call 316-927-5500. For a complete list of services, visit us on the web at kansasperio.com. This is a session of the Create Dentistry Study Club. The club is devoted to developing better dentists through lifelong learning in a team-oriented environment. It's organized by the leadership at Kansas Perio and recognizes the importance of lifelong learning.
We work a lot with general dentists and with other dental specialists. And so we think that, dentists who work together to treat patients could also really benefit from having shared educational experiences, throughout their careers. So in order to do that, we've started a local study club for dentists in the area. It's part of a larger national study club. And it really just lets us get together and talk about specific cases, maybe complex treatment plans, but it also lets us see what each other do, in regards to those treatment plans. So like I said, we don't do the same thing that the dentist does, just like the dentist may not do the same thing that an orthodontist does. So when we're all together, we can kind of see, how all the pieces come together. We can talk about how we sequence treatment and what we need to do to give patients the best outcome.
While dental implants are a primary service here at Kansas Perio and Dental Implants, it's important to review other offerings. Implants can include a single implant, multiple implants, full arch replacement, mini implants, and all-on-4.
When you're watching one of those home improvement shows on television, it makes it look like it's done very quickly and very inexpensively, but it's not always like that. To do an implant and make it look and bridge work and like an all-on-4 or an immediate occlusal loading type of a situation, which is technically what it is, it takes a lot of planning, and it does require a lot of patient parameters that may or may not be there.
If you are unhappy with your tooth to gum ratio, crown lengthening may be the cosmetic procedure for you. By removing excess gum tissue from the affected teeth and reshaping the gums to expose more of the natural teeth, Kansas Perio and Dental Implants can help you reach the smile of your dreams.
My name is Alyssa, and I decided to come to Kansas Perio because the dental office I am working for, we refer lots of patients to Kansas Perio, and I've heard lots of great things from our patients that have seen Kansas Perio, and so I decided it would be a great fit for me to come and check out too. I knew that I wanted to find a specialist because of my gums mainly, just because when I smiled prior to having the surgery, there was so much gum tissue that was showing, and it was a concern to me because it just made me feel self-conscious that my teeth looked small. It definitely affected my life when I would smile very largely. I always have had a big smile, and I didn't let that affect how I portrayed that to my friends and family. But I would always think about it, or when I would look at photos, I would always be thinking about it again just because it was brought to my attention by images. When I came in for the consultation at Kansas Perio, I saw Dr. Weigel, and as soon as I sat down, I voiced my thoughts on how I thought I had too much gum tissue showing and that my teeth were small, and I just wanted to know if there was something that could be done. And Dr. Weigel took some gum measurements, and he took a peek at how my smile looked prior to getting anything done, and he was very thorough explaining that my teeth indeed were too small. I had excessive gum tissue showing, and then he explained to me the procedure of he would remove the gum tissue as well as I actually had excess bone there too. I was a little bit nervous even being in the dental field, just because I had not ventured into something like this myself before. I have read about it in textbooks and all that good stuff, but once I had talked to Dr. Weigel about the procedure, and he explained the step-by-step process of how they would go in and remove the excess tissue and bone. As soon as they jumped into the procedure, I was not nervous. When I was in the procedure, the whole time from start to finish, the team made me feel so cared for the whole time between Dr. Weigel, the dental assistant, even I believe it was the hygienist who numbed me in the beginning of the procedure. Before they stepped in, everyone made sure that I had water if I needed it. They made sure I was comfortable. They would just check in periodically throughout the procedure to make sure I was just doing okay. And everyone was very thoughtful. You could tell everyone worked as a very cohesive team. Post-operatively, I really just dealt with being numb for a few hours following. And then for the next few days following the procedure, up until about day 7, I did have a little swelling. So I looked like a chipmunk in my cheeks for a little bit, but some ice and ibuprofen helped that go away. It was very manageable and very doable to recover from.
Surgical services are designed to provide you with stabilization and increased oral health. These services include pocket reduction, bone grafts, soft tissue grafts, sinus augmentation, and bridge modification.
I had a partial, which I put in the upper, and the lower I barely had enough teeth to chew. I was telling Dr. Weigel that I didn't notice it. It was kind of like the frog in the pan of water on the stove. If it's cold and you turn the heat up, it just stays in there and swims, but if it's hot, jumps in, it flies out. So I was kind of like getting so used to it that I didn't even notice that all I was eating was soft foods. Now I can eat everything. It's like a miracle. I thought, perhaps I'm too old for this. You know? He said, Liz, no, he said, it's the quality of life. And I thought it over and I said, you know, he's right. Why should I be satisfied with just dentures? And then I was actually talking about mini implants, but and he told me, he said, well, there are some risks involved. He said, I can give you a better option. So he worked out a plan for me, and here I am. I think it's just great, just wonderful. Better than going on vacation and having a good time for 2 weeks and coming back and having to pay off that 2 weeks for a year. This way, I got this done, and I got something that lasts. My sister had dental implants a long time ago. She's had nothing but success with hers, and they look beautiful. And she's probably had them now maybe 20 years. She looks great. I know when I was younger, what people did when they had dental problems, it was extractions. And my other sister, when she was 33 or 34, she saw a dentist in Florida who pushed her into getting all her teeth pulled, and she had dentures. And she regretted it to the day she died.
One thing that I can say that's quite different from any other experience, I actually had the doctor call me after each one of the procedures to make sure I was feeling okay, my medications were filled, the nurses were following up with me, and they even provided and even offered, we'll have someone come out and check on you at the resident. As far as I know, I've never had that type of exclusive kind of service provided. So it kind of baffled me at first, like, wow, there's really still people and entities out there that genuinely do care.
For many of us, we fear that trip to the dentist. The trepidation we have is usually handed down to us from our parents and grandparents whose experiences were more painful.
One of our goals at Kansas Perio is to keep patients comfortable at all their dental visits. According to Columbia University's College of Dental Medicine, 40% of patients avoid dental procedures due to dental anxiety. That can be a significant problem, and they can have compounded effects on their health and their dental procedures, making it oftentimes more expensive and time-consuming. This can oftentimes compound issues, dental problems, if patients are not seeing their dentist due to dental anxiety. First of all, our practice is a relatively relaxing facility for a dental practice. So we try to make sure that patients are comfortable when they first walk in the door. But those patients that are still anxious, obviously we do a number of different things. One thing, obviously, before we do any procedures, we communicate with them to find out what their level of dental anxiety is. Once we know that, sometimes all we have to do is use local anesthetic to make sure they're comfortable. If that's inadequate, or if they still have a level of fear regarding the dental procedures, we can sometimes use an oral sedation, which is a pill they take before they come in to make sure they're comfortable as an anti-anxiolytic. Another option would be nitrous oxide, which is also known as laughing gas. And that helps patients feel more comfortable while they're during the procedures. And it's also 100% reversible, so we can turn it off and they can feel free to drive home afterwards. A fourth option would be IV sedation. And for those patients that want to be put to sleep, we can offer that. Oftentimes, the patient is put into a light sleep state, and when they wake up, the procedure has been completed. And they're oftentimes surprised that the procedure is over. Some patients that oftentimes, if we find out that they do have a dental anxiety or if they're aware of it, oftentimes you want to know about that beforehand. And so communicating with your dentist is very important. Things you can do are work on breathing techniques, avoid caffeine, get a good night's sleep beforehand, or just try to do the procedure in a less stressful time of the day. Those are things that we can do to try to help also manage that as well. Maybe early morning appointments. Those are things that we can do. Use headphones. Some patients will use headphones to help make sure that they don't hear a lot of the noises in the office. And again, if those aren't adequate, we can always use one of these other options, such as IV sedation, oral sedation, and nitrous oxide.
With the anxiety, they did offer me a prescription if I felt that it was needed. I didn't really believe I needed that. Honestly, just the experience and the environment itself was amazing. The laughter, making me feel okay and happy to be here actually was enough to keep me calm.
Our primary focus on patient care is understanding that each individual is a person, and there's a person attached to that mouth, if you will. They have their own opinions and their own goals and things like that. And we want to make sure that we're not just treating the mouth, we're treating the person. So getting to know them is really important. Making sure that they know they can call us is important if they have an issue. And so me having to call them sometimes to make sure they're doing okay. I might do that night before or that night after to make sure that they're doing all right and they're prepared for the procedure, or that they're responding well to the procedure as well. So we have a regular follow-up to do that. The other important thing about building a relationship with the patient is that with periodontal disease, it's a complicated process, and it requires a lot of education and understanding. And getting to know that person and knowing where they're at with their disease helps us to get them healthier and get them moving forward with that too.
Basically, when you walk in the door, they greet you and the way that they greet you is the smiles. They know your name, they know everything. You know, hey, nice to see you. You sit down, and as soon as you get back in the dental chair, I mean, they already know who you are, what you need. Dr. Wagle comes in, he's very pleasant, and like I said, the atmosphere is the best. They usually give you, in the evening, they will give you a call, see how you're feeling, things of that nature, and then they set up an appointment, and when you come back, it's the same experience. Kansas Perio Dental really does actually care. They really do about your presence, your smile, how you feel about yourself. They take care of you emotionally on top of all of your dental needs.
Following the procedure, I did get a phone call from Dr. Wagle. I believe it was the night of the procedure or the next day. I can't remember exactly, but he just checked in to make sure that I was healing okay. If I had any questions, he just made sure that everything was healing how it was supposed to, and to give him a call if I had any questions following the procedure. That extra touch of having the phone call from Dr. Wagle following the procedure just made it that much more emphasized how much Kansas Perio cares about their patients. I am just elated on how everything turned out. Even coming in, everyone's so welcoming, and seeing everyone for the post-op checkups, and I just love how everything looks. I am very happy.
Thanks for watching and taking the time to learn about the comprehensive services offered at Kansas Perio and Dental Implants. The team of professionals is ready to help, and new patients are welcome. Call now at 316-927-5500 and see all of our services at kansasperio.com.
When I look in the mirror now compared to before the procedure, it makes me feel so confident now. I have no concerns as far as my smile. It just makes me want to smile even more than I already did. And I am just very happy.
When you have dental issues, you lose your smile. It does affect your self-esteem, but when you have people like Kansas Perio who take the time to give you that back, it gives you your life back, honestly.